Good afternoon, everyone, and welcome to the third session of our training series, Implementing Medication-Assisted Treatment in Recovery Residences in Pennsylvania. My name is Jenna Nesbitt. I am a recovery specialist at C4 Innovations, which you may also know as Center for Social Innovation. This event is brought to you by the Substance Abuse and Mental Health Services Administration's Opioid Response Network and the Pennsylvania Alliance for Recovery Residences. The Opioid Response Network is a consortium of partners dedicated to increasing access to prevention, intervention, treatment, and recovery support. We achieve this work through a variety of mechanisms, including technical assistance focused on systems transformation and developing the capacity of peer-run recovery community, family, and youth-led organizations. I am pleased to introduce today's presenter, Jennifer Reha, also a recovery specialist with the Opioid Response Network. She will be talking about implementing medication-assisted recovery in recovery residences. I will be turning things over to her shortly, but first I'd like to review a few housekeeping items. Please remember to mute your computer microphone and speakers if you are calling in and using the phone. The computer speaker can be muted by clicking on the green horn on the upper left-hand middle corner just above the headshots. If you have any questions during the presentation, you can use the chat and questions box located at the bottom left. If we have time at the end of this session, we will answer questions. Any remaining questions will be answered at the beginning of the next session if we run out of time today. We also have resources for this webinar available for download from our webinar resources box. To download a file, click on the name of the document, then click Download File. Also, we will have a survey link available for you at the end of today's webinar. Please let us know how we did. This event is being recorded, and the recording link will be shared with all registrants after the event. You'll be able to review the chat and rewatch the presenters using that link. And without further ado, I present to you Jennifer Reha.
Thank you, Jenna, and welcome everyone. We're so happy that you could join us today. As Jenna said, this is part of SAMHSA's State Targeted Opioid Response Network, and we do want to point out some resources that are available. The Opioid Response Network does provide technical assistance and it is available to organizations that have a specific need or request, and you can put in a request for education or training. And the contact information is right here. There is an address for the opioidresponsenetwork.org. You can also directly send an email or call if you do have a request for technical assistance. So for today's discussion, what we're going to look at are whether there are certain levels or types of recovery residences that are a better fit for residents who are in medication-assisted recovery, and we may refer to that as MAR throughout the training today. And then how do fair housing laws integrate with the residence's policies pertaining to accepting residents in MAR? How should a recovery resident screen potential residents who are in MAR? Should a recovery residence separate or integrate MAR and non-MAR residents? How does one go about building a MAR-capable environment in a recovery residence? Should your relapse and eviction policies be different for residents who are in MAR? And what type or level of collaboration should a recovery resident have or try to have with the treatment and service providers in their community? And should that collaboration be different for residents who are in medication-assisted recovery? So going ahead and getting started, we're going to do a little review, which most of you may already be aware of. The National Association of Recovery Residences, also referred to as NAR, has 4 levels of recovery housing. So the level 4 recovery houses are ones where clinical services are provided. Level 3 typically are supervised by clinical staff. Level 2 are monitored and typically do have at least some level of paid staff. And then level 1 typically are peer-run and are democratically managed by the residents themselves and likely do not have any paid staff. So one thing that we do want to acknowledge is that typically supporting individuals in medication-assisted recovery in a recovery residence is best suited for levels 2 and 3. Now, the reason why level 4 isn't included in that is because level 4 recovery residences typically are or are very like residential treatment centers, and they often do already include medication-assisted recovery in their continuum of care. We are going to talk about some possibilities and opportunities for level 1 residences to include individuals in medication-assisted recovery in their population, but we do want to acknowledge that there are special barriers and challenges that have to be overcome in a level 1. So in a level 4, as we said, they typically have credentialed staff. The facility is often aligned with or attached to a licensed treatment provider. A credentialed or qualified management team oversees the activities and services, and the staffing levels easily provide the appropriate oversight for individuals who are newly in medication-assisted treatment. Level 3s typically have a facility manager. They have certified staff or case managers. They have professional staff providing oversight. They have paid staff and an organizational hierarchy which facilitates appropriate oversight for individuals using some forms of MAT and or for individuals who are early in recovery in MAT. A level 2 does typically have at least one compensated position, and the compensated peer, whether that's a house manager or a senior resident, does provide oversight, but they usually have few paid staff members available to provide oversight necessary for individuals taking medications on site. And a level 1 typically has no paid positions within the residence. There may be an overseeing officer. They're typically democratically run and peer-based. The residents are self-monitoring and accountable to each other. Some are employed so that peer support is needed during non-work hours. So in a level 2, the residents are going to rely more heavily on the residents themselves to implement and oversee the recommended safeguards around medication-assisted recovery, whereas a level 3, they're going to rely mostly on staff to provide the oversight and management. Level 1, they're advised to democratically consider how safety and security would be maintained with the integration of medication-assisted recovery residents into the house. And ideally, individuals who live in a level 1 residence have had some level of stability in treatment for a period of time or may have completed treatment, although we do recognize that this may not absolutely be the case if there's a shortage of recovery housing in a particular area. So one of the questions that we wanted to start with for all of you who are participating in the webinar room is an audience poll around what challenges related to supporting residents in MAR does your residents face due to staffing? And so the options, you'll see them listed there, are none. You right now have no challenges with staff and supporting residents. Some of you may have challenges around securing and storing the medications or having a staff person who can observe residents taking the medications, having a staff person who can verify residents are attending their appointments, having a staff person who can log the medications being brought into the house and doing routine medication counts, having a staff person who can advocate and educate all of the residents about medication-assisted recovery. So if you would take the time to fill out the poll, that helps us and helps let your peers know that you may be facing some of the same challenges or different challenges.
Jennifer, is this a poll where they can select more than one answer?
They can. Yep, you can select all of the challenges that might be facing your residents.
So we've got some results coming in, as you can see on the screen. We have, I think, the widest amount of responses around having a staff person available to observe residents taking their medication appropriately. Securing and storing medications are also a concern. And then having staff members assigned to regularly verify that the resident is attending their medical appointments. And a few of you, having a staff person who can advocate and educate the residents around medication-assisted recovery. So certainly the poll is closed for voting, and this is very helpful information as we move forward with the training that we do with medication-assisted recovery in recovery residences. Turn it back over to you, Jen.
Thank you. And the responses in the poll definitely mirror responses that we hear across the industry in general, that having staff people available throughout the day who can monitor when residents take their medications, who can count the medications that are on site and log them as they come in, that's a challenge that is faced by many recovery residences. So certainly those of you who responded are not alone, and certainly there are others who face those same challenges. So one thing that we want to sort of acknowledge is that in a level 1, certainly there are safety and security challenges. In a level 2, there's staffing challenges, and that gets to the response from the audience around that you may have some protocols in place around medications and maybe even securing medications, but that doesn't mean that you necessarily have the staff people available to observe medications on a daily basis. And so I'm guessing that we probably have a fair number of people who are currently operating level 2 recovery houses where that's most frequently a challenge. Additionally, in level 3, we do recognize that that is the level that probably accommodates residents in MAR most easily. And then in level 4, it is often a residential treatment program or is linked to a residential treatment program, so it likely does incorporate some form of MAT already. And so one of the things that we do want to acknowledge is that it might be absolutely appropriate for a level 1 resident to serve residents in MAR, but what we need to make sure of is that all of the residents who live in the house, that they have the opportunity to democratically decide on a person-by-person basis that a potential resident would be a good fit for the environment, and that the potential resident is committed to implementing and maintaining the security of his or her own SUD medications. Now that's the same as would be expected for them to maintain the security of any medications. And typically, we do anticipate or hope that this is a situation where the residents have been stable in their recovery for some period of time already. Now, level 2, you may be able to overcome the safety and security challenges by having a paid staff member who ensures medications and records are safely secured. However, it is unlikely that a paid staff member is going to be available every time the resident needs to access and take their medication. So there is still going to be considerable reliance on the resident themselves or the other residents to make sure that the medications are safely secured and that the medications are taken appropriately. So another thing that we wanted to have a discussion about today is fair housing, and we have discussed this a little bit in some of our previous sessions, but we do want to review the Fair Housing Act does provide people with protection from discrimination when they are renting, buying, or securing financing for any housing. And the protected classes under federal housing laws do protect on the basis of race, color, national origin, religion, gender, family, and disability status. And disability status, we do want to make sure that people remember that individuals who have a substance abuse disorder do meet the civil rights definition of having a disability and cannot be discriminated against based on their use of a particular medication to address that medical condition. However, fair housing protections do not extend to an individual who is actively using illicit substances, is engaged in criminal behavior, or is a threat to others or other property. So for these reasons, it is especially important to have clear rules and guidelines around the expectations for behavior in the residence and guidelines for how relapse is going to be handled. Additionally, housing admission criteria such as requiring that an individual meet your eligibility requirements for being in recovery from an SUD, or if you specifically serve individuals of a particular gender, those are allowable under fair housing laws. So the big question is, how should a recovery resident screen potential residents who are in MAR? And the answer is pretty simple. It's exactly the same way all other potential residents are screened. So we want to do another poll. If you would take a look at the left-hand side of your screen. The first question, and this is anonymous, is does your residence have screening or application forms that are given to every potential resident? And then the second question is, if your residence also does potential resident interviews, do you use the same questions and talking points for every interview?
This is Jenna chiming in. So as we look at the answers that are coming in, it looks like everybody is very consistent in how they screen application forms and how they structure interview questions. We have close to 20 responses, and that's a good thing. We'll give you guys just another little bit to answer the question. Okay, so the polls are closed. It's an even 10 and 10, Jen.
That's definitely good to see. So we are going to talk about the fact that it seems like everyone on today, or the people who answered the poll, are doing it the right way. So screening applicants who are using MAT can be challenging in a level 1 and in a level 2, especially if we don't have staff or highly trained staff. And so in many cases, applicant screening is done through a democratic process among the recovery community. And we know that to maintain a safe living environment, residents and peer staff often do err on the side of caution when applicants are using medications that might be viewed as a potential threat to the community. So since we know that categorical exclusion of a person using MAT is illegal, we need to make sure that recovery residences have alternative screening tools to help discern whether an individual on MAT has, 1, recovery goals that align with those of the particular recovery house, and whether or not that particular recovery house can meet the needs around medication or otherwise for that individual. And that those are the types of things that we're focusing on when we're screening, not what medication do they take or are they using a medication to support their recovery. So one of the things that we need to make sure of is that operators do have formal screening tools that are focused on behaviors, that are focused on a commitment to recovery, and that are given consistently to all potential applicants. All applicants should be asked about their relationship with a treatment provider if they're still in treatment, not just those in medication-assisted recovery. And operators need to make decisions about residency based on standard questions, standard criteria that do not specifically include whether or not the individual is in medication-assisted recovery. Now, this might mean that an individual who is using medication-assisted treatment is declined for residency and that they're given a referral for someplace else. And that's totally fine, just so long as that the reason that they're declined is not based solely because they are in medication-assisted treatment. And so as with any applicant, the evaluation process should demonstrate that your residence is able to meet a particular individual's needs and whether it is able to support residents who use medications. The process should be consistent across all applicants, should focus on do they meet the house's eligibility criteria regarding a substance use recovery history, a particular population, and is the individual able to meet the terms of your resident agreement, including financial obligations? Are they committed to upholding your particular house rules? Are they able to meet your particular house expectations? And pre-acceptance conversations should engage applicants in discussion about their recovery plans and their willingness to abstain from alcohol and illicit drugs as conditions of the environment. Specifically, potential residents in medication recovery should not be told that they will need to taper or discontinue MAT as a condition of continued housing. And I see a comment in the box from Jenna, and I want to reaffirm that it is absolutely a good idea to document your application process, document your screenings, and if you are declining someone for residency, you should always document the reasons why. Specifically, as Jenna pointed out, if they are in medication-assisted treatment, it is important that you document the reason why they were declined, and that it clearly was not because they're in medication-assisted treatment. It was for whatever other reason that they didn't meet your criteria or were not a good fit for your environment. So each applicant's goals should align with your recovery residence's philosophy, services, support offerings, regardless of whether or not they're in medication-assisted recovery. We also want to suggest that you inform applicants right up front that they may need to permit you and the prescribing physician, if they have one, to communicate with each other. You also want to be very clear about policies that you have pertaining to safekeeping and managing medication. And if an applicant is not a good fit for your residence, always try to offer referrals to other residences that you may be aware of that might be more appropriate. But we do want to be clear that residents in MAR are expected to engage in personal recovery programs and participate in residence activities just like any other resident. We want to make sure that this is absolutely clear in the interview, absolutely clear in the acceptance process, and avoid misunderstandings, and make sure that all applicants understand the community expectations. Now, with regard to exchanging information with treatment providers, and we will talk about this a little bit more later today and in the next session, but we do want to make a note that you will need to obtain a release from the applicant for that communication, and the treatment provider that you would be exchanging information with may have their own form that they'll require you to use in order for them to release information to you or your staff. And so we'll talk a little bit more about that process, but then also about your responsibilities to secure records and secure information under sort of the legal requirements in our next session. So another thing that we wanted to spend some time talking about is the difference between MAT accepting and MAT capable recovery residences. And so when we look at the National Association of Recovery Residences definition of MAT capable recovery residences, they say that these are residents that are capable of adequately supporting one or more residents undergoing all forms of MAT, while also supporting the safety and recovery of other residents and peer staff who may not be undergoing MAT, including those who may have had a negative experience with MAT. MAT-capable residences can use a mixed population approach, meaning that they may have people who are on MAT and people who are not on MAT living in the same household. What we want to point out is that this is in contrast to recovery residences that accept individuals who are in medication-assisted recovery begrudgingly, based on solely trying to avoid anti-discrimination violations or in order just to access state funding. Accepting individuals in MAT does not go far enough. The goal is to create an environment where all residents' path to recovery is supported, respected, considered, and for residents and staff to understand and accept that their housemates' experiences and their housemates' choices may be different from their own, and to proactively take steps to support their peers' success in the recovery community, even if it is a different path and a different approach. And so a question that frequently comes up is, should our recovery residents separate or integrate MAR and non-MAR residents? So we do acknowledge that the courts have yet to rule on the legality of housing segregation based on MAT, but the Legal Action Center's position is that, as we've already noted, categorical exclusion of individuals on MAT is illegal. So we want to emphasize the importance that our community continue to develop evidence and research on the impacts of integration versus separation, that we focus on the importance of ongoing and open dialogue, and the importance of residents and staff commitment to supporting a housemate's decision regarding recovery. And we acknowledge that there is considerable debate and commentary on integrated recovery housing, but there is actually very little research regarding whether integrating MAR residents with non-MAR residents results in any increased relapse or increased negative experiences for non-MAR residents. So you may see discussion or commentary on that, but there really is very little peer-reviewed or extensive research to be able to point to that as a true barrier or a true concern. But we do absolutely want to continue to monitor the evidence and research on that. Practically speaking, we do also recognize that it is likely that a recovery residence that has individuals who are in MAR are going to end up being integrated versus separated or specialized, especially considering that a person who is on MAT at some point may stop being in medication-assisted treatment, but they might still live in the residence. And so the other scenario is that there are a lot of areas where there's a shortage of specialized recovery residences, and so residents may not have a choice between integrated or separated. But the key point is to ensure that all residents' recovery experiences are respected, recognized, and to try and create opportunities for open and honest dialogue among residents. And this is especially critical in a level 1 or a level 2, where the residents are going to be taking on the primary responsibility for keeping their medication stored securely, and there are limited paid staff or maybe no paid staff in these types of environments. And so what we want to focus on is operators taking the initiative to educate the residents in their houses and the staff who may come from an abstinence-based treatment experience or philosophy about medication-assisted treatment, and to recognize that medication-assisted recovery draws from both sets of experiences and treatment protocols. We did spend an extensive amount of time in session 1 talking about the neuroscience of the disease of addiction, of the impact of the medications themselves, being able to see the structural changes in the brain. If you were not able to attend session 1, we do strongly encourage that you reach out to Fred Way at the Pennsylvania Association of Recovery Residences, and I believe we're going to include his information in the resources if you don't have his email address to get access to session 1. Because we want to really encourage you to take the time to review it yourself if you weren't able to participate, but to also consider taking steps to educate the residents and taking steps to educate all staff that might be working in the residences, just to have a better understanding of exactly what we're talking about and exactly what is going on within people's brains during this process. We do also recognize that operators of recovery residences are constantly having to perform a balancing act of supporting people in MAR while also appropriately supporting other residents and peer staff, especially those who may have had a negative experience with MAT, either personally or with those around them, and balancing both of those experiences, both of those perspectives. One thing that we would like to strongly encourage is that you seek to set up formal forums for discussion. And so within your residence, if you're able to schedule having a specific discussion, having a specific open conversation about medication-assisted recovery, about having people in the same house, some who are in medication-assisted recovery, some who are not, and success stories, but also concerns, and having an open, honest, safe dialogue. Those are the types of things that are going to help us move forward with reducing stigma, with being able to have individuals on different paths all living successfully together. So we would like to do another audience interaction poll. So this is a question that we wanted to ask. Based on your experience, is it harder for residents who are more likely to be in early recovery, or for staff who probably are in longer-term recovery, to accept different paths of recovery, including MAR, if their own experience is different?
So it looks like we have about 5 responses so far. This is a question that might require a little bit of reflection. We'll give everybody just a few more seconds to answer the question.
Is this thing muted?
So far, it looks like staff with longer-term recovery may have a more difficult time accepting different paths to recovery, which includes MAR. And there's an equal distribution among some of the other answers. So the polls are closed. We thank you for responding.
And so the responses that you all provided are not different from what we sort of see nationally or what we see across the board, that often it is harder for people who may have been down a different path or may have had a different experience to fully accept and to fully embrace that someone else's experience that is very different from their own may ultimately get them to the same goal or the same outcome. And so one thing to keep in mind and one thing to really think about is, what do we do with that? What do we do about that? How do we take steps to educate people in a caring, kind way, but giving them the information to be able to get past that and to be able to move to a place where they can have an open mind about other people's experiences? And so one of the things that we really think is most important is educating residents, but also educating staff. And this does take work on the behalf of the operator. This does take special effort, but educating not only staff and residents who are not in MAR, but also educating residents who are currently using medications for medication-assisted treatment. As with any disease, as with any medication, just because you may have experience with it does not necessarily mean that you have all the information. And so the more that we can distribute information, the more that we can share information, the better it is for everyone. The other thing that we encourage is sharing success stories, but openly discussing concerns as well, and providing those safe spaces within the residents for those things to happen. We also suggest that you provide connections to MAR welcoming recovery support services, including considering developing or offering an all-recovery meeting or some other forum where all paths to recovery are accepted, all paths to recovery are equally acknowledged and seen as effective and appropriate. So the next question that we want to consider is, should the residents have a different policy or special policies for relapse for individuals who are in medication-assisted recovery versus those who are not? And so the answer is no. Medication-assisted recovery residents should be treated exactly the same way as non-medication-assisted recovery residents. If a medication-assisted recovery resident relapses, that could be using illicit substances, or it could be found to be using their prescribed medication outside of prescribed practices. The recovery resident's relapse policy should apply. Now, we do want to make note that each recovery resident should have a written formal relapse policy, and it should have procedures that do not punish an individual for relapsing, but that are focused on protecting the health and well-being of the individual and the recovery residence community as a whole. And this might include moving individuals out of the recovery residence, whether permanently or temporarily, and it may include linking them to a level of support that will help them reinitiate recovery, such as a residential treatment center. And as with all residents in a recovery residence, length of stay varies depending on their needs, their progress, their willingness to abide by the guidelines, and the payment structure of the resident. So we also want to spend some time talking about collaboration. So one thing that we have seen is that many community referral sources, such as treatment providers, recovery community organizations, peer support organizations, are not educated enough to make informed referrals to the appropriate type or level of recovery housing. And so it does then fall to the operator, to the recovery residence provider, to ensure that the community partners are equipped with the information outlining what individuals are appropriate or what individuals are eligible for residency in your recovery house. So we do have one more audience poll, and the question is, do the treatment and recovery support providers in your community fully understand recovery housing to the extent that they can educate the people that they serve and assist them with making appropriate housing choices?
So we have some responses coming into the poll, so far 3, indicating some variation between providers being able to fully understand and make appropriate referrals. At this point, it looks like providers try, but they sometimes don't give accurate information. And that probably varies across each region of the states. So we're going to give everybody just a few more seconds. The poll is closed. And at this time, we understand that we have an opportunity to educate some of the providers in our area. I'm going to turn it back over to you, Jennifer.
And so your responses, again, really reflect the recovery community broadly, that oftentimes the treatment community, the recovery community really don't have all of the information and the details that they need to be able to really partner with the recovery residences in a meaningful way. So one of the things that we recognize is that prescribers, clinicians, and recovery residence operators often lack processes or tools that would facilitate the partnerships to coordinate resources and to coordinate collaboration. And beyond simply making referrals, medical and healthcare systems don't really have a history of working with the recovery community and especially with recovery residence providers to deliver coordinated care. And so then it falls, as we said before, to the recovery community and to the recovery residence operators to try and facilitate training and to try and facilitate cross-system dialogue to improve that coordination. So one of the first things that we want to suggest is that you look for opportunities to educate and engage treatment providers directly. And we suggest that you first start with identifying who are the treatment providers in your area. Create the list, and then the first thing you want to ask is to be able to speak to or give information to their case managers. So whether that's the case manager's supervisor or if that's the case managers directly, you want to be able to discuss with them what does your residence or recovery residences broadly offer, what specifically are the guidelines, what is the level of recovery residence that you are providing, is there a specific or special population, but you also want to take time to educate them around how you secure medications, how you secure health information, how you are a critical component and factor in supporting individuals that they are treating in reaching their treatment goals. We want to talk about how being involved in recovery housing has a positive impact on treatment outcomes and on reducing relapse. And so the next thing that we want to suggest is looking for recovery community organizations, peer-run organizations, forums, roundtables that may be going on in your community, and ask to participate. Ask to be present, to be able to talk to their members, to be able to talk to the other people who are a part of that discussion. And really look for the opportunity to educate, again, educate the treatment community, the prevention community, and then even the recovery community outside of recovery housing around what exactly recovery housing does, how it supports people. And the goal here is not to simply get referrals for recovery housing, but it's to create a lasting relationship and a partnership where all the sectors of the substance use disorder community are coming together, are understanding the role of each party's efforts and that each party plays in supporting people. And the more prevention and treatment providers understand about how recovery residences work, how they're structured, how they have policies and rules, and how they specifically take steps to protect residents and to protect the community, how they support individuals' success in recovery, the more likely that they are then to be a strong advocate and partner for recovery residences in their community. The other option or opportunity is talking to funding entities. And so if you have county, regional, state funding boards, agencies, if you have the opportunity to provide information or to explain how you manage your recovery residence, how you ensure safety, how you ensure security, all of those things go a really long way in helping to reduce stigma and helping to really show that the recovery residence community is a partner in facilitating people's success, is a partner in facilitating long-term recovery. Now, some of the things that you might want to, or we strongly suggest that you consider, are for the safety of the residents and the recovery environment, consider requiring that residents who are in MAR, and really residents who are taking any medication, consent to ongoing exchange of information between their identified treatment provider and the recovery residence operator whenever necessary. Consider requiring evidence of ongoing engagement in treatment, and that's for both people in medication-assisted treatment and people who are not. Once the consent form is in place, you will likely need to proactively reach out to the identified treatment provider, let the provider know that you're committed to being a supportive partner in the resident's recovery, invite them to contact you, give your contact information, but then also from the other end, if you have specific concerns, if you observe marked changes in behavior or mood that might be related to the prescribed medications, make sure that you are reaching out and letting that provider, that prescriber know of your concerns. So once you've developed that collaborative relationship, the next step that you really want to look at is there an opportunity to create a pathway to have a structured, recurring opportunity? So especially if you have more than one resident who is with a particular treatment provider, if you're able to have some sort of monthly, weekly, reoccurring opportunity where you are providing information about how the person is doing in recovery, any feedback you feel that the prescriber or treatment providers need to know about. And then same thing from the prescriber, if they're letting you know, like, well, we're changing this particular resident's medication, you might see these new symptoms, we're increasing it, we're decreasing it. All of those things come together to create a partnership to support the residents. Now, sometimes that's not possible. The treatment provider may not be willing, or you don't have staff who can do that sort of regular, recurring interaction and dialogue. But at a minimum, the treatment providers need to know how to get a hold of you, whether that's just a phone number, but there needs to be a way for you and the treatment providers to be able to communicate and to partner in supporting the individuals that you have in your residence. And really, by connecting with the community partners to establish more resources for people in medication-assisted recovery, you are supporting a more established continuum of care for your residents. This also benefits the longevity of the recovery residents itself in the community, because it helps to diminish the not in my backyard perspective, helps to diminish feelings or perceptions that are discriminatory or that still hold a lot of stigma. And what we know is that it isn't just other people who hold those perspectives. Often those perspectives and those opinions are even within our recovery community, whether that's in the treatment provider community, whether that's in people who are not fully accepting of medication-assisted treatment. But the more that we can demonstrate that we are a committed partner, that we are committed to supporting the recovery of these individuals, and that we want to collaborate to support their success, the more that it cultivates support for the house itself, it cultivates support for your residents, and it cultivates support for recovery residences broadly in the community and across the region. And so as we look at what we're going to be discussing in the next sessions, we're going to get more into specifically how to handle and how to store medications on site, staffing related to MAR resident needs, specific securing health records that you might receive from treatment providers. What are the rules of that? How do you ensure privacy for the residents? Specifically collaborating and communicating the specific health information with treatment providers, and then how do you handle drug screening, and is the drug screening different? So we do want to take some time here to open up the chat and question box for questions. So if you have specific things that you would like to ask or discuss, we invite you at this time to go ahead and put those in the chat and questions box, and we will go ahead and respond to those.
So we already have one question from Bernard, who asked if there is any grant money out there to help someone open up a MAR residence. So I'm not sure if you're in Pennsylvania or not, Bernard. It does vary from state to state, depending on how the state wrote their application initially for the state's targeted response, and which we all did, all the states did in 2016. And it also depends on how the state you're in wrote their application for the state's opioid response, which is the follow-up money to the STR. But it's something that if you're in Pennsylvania, you would want to refer to your SCA, your single county authority. And if you are in a state that does not funnel money through the counties, but through at the state level, you would want to reach out to your state, either health department or human service commission, behavioral health department. They typically have teams that they list on forward-facing, public accessible websites that will provide you the email contact information for the person in your state who can answer the question. Jennifer, do you have anything you want to add to that?
No, just that I agree it really differs state by state what the funds are available. The other thing that I would suggest is that if you did want to refer to the contact information in the beginning of the presentation, you may be able to get additional information by going to the technical assistance request through ORI, and they might be able to direct you to the right person as well if you still have questions.
That's a great reminder, Jennifer. Thank you. And then one more dovetail for Bernard's question. The SOR funding that states applied for in 2018 had a required activity of supporting recovery housing for people with opioid use disorder and specifically MAT. So it just, again, depends on how your state indicated that they would do that. Some states are actually giving money, such as grants, to open houses. Some are supporting staff FTEs or full-time equivalent personnel. And some are providing stipends for rent or subsidies, if you will. So there's a lot of different ways that the states are addressing this, but every state is required to do something with recovery housing. And that was a great question, and you're welcome. And please use that email address to reach out to us, the website actually, and we can give you more details and help you out. So while we give others just a few more minutes to type in any questions, Jennifer brought up a good point about recovery residence operators being able to refer their residents to meetings that might be more conducive for somebody that is utilizing medications for opioid use disorder. And I just wanted to point out to you that a lot of recovery residence operators may be familiar with SMART. And in areas where you don't have a SMART meeting, SMART does offer online meetings. Additionally, another resource that I wanted to share with you is there's an up-and-coming group structure called MARA, Medication Assisted Recovery Anonymous. And if you Google MARA International, it is the first thing that comes up. This website provides background information about this 12-step group structure for people using medications, and also has a location finder. And there are more and more MARA meetings popping up everywhere across the nation. So those are just two resources we wanted to share with you to help prepare you for accommodating people on MAT in your home.
Thanks, Jenna. Those are really good resources.
Yes, my pleasure, my pleasure. And you've got a lot of compliments coming in on how informative this webinar has been for our attendees. And we're just so excited to see such a great cross-section of people tuning in, if you will, to get the lowdown on this intersection between an evidence-based practice of MAT and an evidence-based practice of recovery residences. And there's really not an evidence-based practice yet for how to merge them. So we thank you guys for being along with us as we try to discover what's promising and moving forward.
Absolutely, and I do want to encourage everyone to, if you're able to, please do attend the next session on operations as we start to talk even more about sort of practical issues. And it looks like, Jenna, we do have another question or comment.
Yes, Christina points out that they may have participants who, that there's a large number of people who are Spanish speaking, while there may not be very many places that have Spanish speaking personnel. So that's one issue. And then another issue is that there's a lack of shelters and recovery houses for women, and how can we address that? Woo! Those are some really big questions. With regard to the Spanish speaking, there are certain requirements, the class standards that SAMHSA puts forth with any funding that they do. So again, the states should have addressed what that would look like as far as cultural competency goes in their application. And it looks like Dennis has replied that if you're in Philadelphia, Fresh Start has recovery residences for Spanish-speaking individuals. So that's great, Dennis. Thank you so much. I'm going to note that for later, too. And then as far as recovery housing or shelters for women, recovery shelters, as opposed to more permanent residences, single-family homes and apartments, or SRO, single-room occupancy style dwellings, they're starting to kind of pop up in other states. We see Healing Transitions in North Carolina has a programmatic structure such as that. Women's houses are a little harder to stabilize because typically they're the caregivers and have other, and I'm just saying, speaking broadly, typically, have maybe some family obligations that require them to leave recovery residences sooner than men. But this, again, is something that we want to direct you back to your state. Also, you may want to put in a TA request using the link that Vanessa has supplied in the room, and I believe if you scroll back up, you'll see it in red font. And we'd be happy to help you work on that in your area if you would like.
Absolutely. And Christina, your observations really do match up across the country that those are specific populations that have fewer resources and the options are more limited. And so the more that we can all do to make sure and update each other and make sure that everyone is aware of what the resources are that are out there, but then also, as Jenna said, to work together to develop those resources, it helps all of us. Fred did make a comment that, Christina, if you did want to contact PAR, there is an updated recovery resource manual that identifies the resources in the different regions who have the specific specialties. So for anyone who's looking for a specific specialized population, I think that would probably be a great resource.
Okay. Thank you, Vanessa, for providing the PAR link. I do want to acknowledge Melissa and Vanessa are running the show for us, helping to actually keep us on track and ensure that you have the links and the downloads that you need. We couldn't do this without them, so we do appreciate their assistance with the webinar today. I don't see anybody else typing any questions in. I do want to remind you that this has been recorded, so once we conclude, you'll have access to the recorded webinar. We've really enjoyed getting to spend some time with you today, and we thank you for joining us. If you have any more questions, you can put them in the chat box. Please remember that you can request technical assistance from the Opioid Response Network at any time. That's the link we talked about. Finally, there will be a short survey. A link will be provided when we conclude. This helps us fine-tune our work to benefit you and the others who we serve through technical assistance requests. Once again, thank you for joining us, and we hope you all have a wonderful day.